think if you look at a human being and you limit their options to load share, you're going to end up with issues. These things can be potentially, anyway, continuing the pain cycles, maybe setting the scene for flare-ups, and they don't know that a flare-up doesn't mean they're injured and they're back to square one. That, I think, is powerful for people.
Pain is something that we all feel. I'm sure it's the reason for many of us why we got into training in the first place. Stretching, strength training, to feel healthier, feel more robust, and that we can tackle life's challenges. Today's guest, David McGettigan, is a pain and a movement specialist. We're going to talk about our perception of pain, how we can move away and change our relationship to it, and how we can become more robust human beings with lifestyle habits. I really hope you enjoy this conversation.
What are you working? Is it mostly clinical stuff? Are you seeing
So
patients?
At the minute, it's very much clinical stuff, and the kind of common presentation for me are the people that are struggling, that have been a lot of places, that have had maybe consultations with surgeons, with orthopedics, with specialists, and are still maybe not getting to where they think they should be. Mm-hmm. That's kind of my bread and butter, to put it that way. I've fallen into that over time. It was definitely not where I started, not where I ever anticipated going. I was definitely, when I came out of university, I was taught to massage, manipulate, stretch, and strengthen, and there was a bit of reasoning about injuries and red flags and stuff behind that. And after that, it was like, don't really know why stuff is happening. Don't really know what I'm doing 100% of the time. Obviously, you're only coming out of college. You're the tip of the iceberg.
Yeah.
It was an interesting one. I actually got really disillusioned with it at the start and attempted to quit.
From being a physio?
Yep.
But
so
was that just because
So technically I didn't actually study physiotherapy. I studied sports rehabilitation, which is like physiotherapy minus the respiratory stuff, like the kind of CF physiotherapy, chronic cystic fibrosis, all that side of things, and minus the neuro. So I was kind of more geared to sports teams and athletic populations and that type of thing. When I was studying, I did a bridging course here in Ireland before I went and studied that, and I kind of did shadowing of different therapists and stuff, and didn't really enjoy the shadowing for the physio side of it, because it was kind of, at the time, and it could have just been the days I was in, I was kind of seeing people get a little bit of assessment and handed sheets of exercises, and then I was like, not really sure what I was doing.
Was it the things that you were taught at university when you were then applying them to patients, was the results maybe more inconsistent?
Yeah, totally. That was the thing. I mean, I kind of felt like I didn't have confidence as a therapist, which, I mean, you're probably not expected to have that. I was expecting myself to have it, but you're not really supposed to have it when you leave university. You probably need experience, and the confidence comes after all of that. And then I was, let's say I get someone with knee pain, I was treating them with the stuff I was taught, the kind of processes, the kind of cookie cutter kind of template stuff. And some people would get better. Some people would not really change. Some people would get better for an hour, 2 days, a week, ring you back up and say, David, that's all kind of back. I don't feel any different. And I'm kind of scratching my head going, well, what the hell? Is it me? Is it my treatment? Was it the pressure I use with my hands? Have they done their homework? Is it something to do with any of those, any and all of those factors? And I really didn't have a clear indicator as to what was happening. So I remember going through a spell where a lot of people didn't really get better, and I was like, oh, this is not for me. And I actually told my parents I'm thinking of going back to study music because I don't like this. I'm a keen musician as well.
Yeah.
They sat me down and said, absolutely not. Get your head out of your you-know-where and actually try to do something different and stick with it. Do you know?
Is it an interesting point? Because I guess being a physio should be relatively standardized, right? Like most people receive similar education.
Yep.
And the advice that, like, if anyone says to me, like, on an injury, I don't tend to give advice on injuries because I'm not qualified in that way. I've dealt with plenty of my own.
Yep.
But I understand that there's much more to it. And you always say, like, I'll go see a good physio. But it can be so hit and miss. What do you think the reason, like, what makes a good physiotherapist practice?
Yeah, that's a good question.
What are the things to, like, look out for?
If you'd asked me that years ago, I probably would give you a different answer. Sure. So years ago, I would have been very much about the biomedical hands-on you have to get someone who's skilled that way. Now, I think that's an important facet of it. You want to have, the therapist wants to have confidence in that, and obviously you can't know that going in, but the other thing that's important, I think, is that they look at you as a whole person. That is
Not as just the injury.
not just the injury, because I mean, what I would see in clinic as an example would be people who, like, the population I tend to work with is quite different from an acute ankle sprain, an acute hamstring pull.
Yeah.
These are people that have been struggling for maybe 6 months, 6 years, 10 years, 15 years, on and off, intermittently, or maybe constantly. So there's a very different set of needs. So it depends on what you're presenting to the clinic with.
So maybe if you were going to get assessed, like you would hope that the physio would ask about different lifestyle factors other than just like, where does it hurt?
Absolutely. And that the assessment process, personally for me, the assessment process doesn't just focus on the site of pain and maybe the joint above and below. It looks at the whole picture. Because as a simple example, a person with back pain comes into the clinic, and if you only look at their back or maybe their hip, you might get limited information, whereas they might have a neck that is really restricted, and that from a movement sense, if you have a system of movement that you understand and you can work with, and it kind of helps you understand the interconnectedness of the body, then you might see that neck that can't move chronically, that might not be that painful but is restricted, is feeding down into a lack of movement around their hips and pelvis, and that could be missed completely. Do you know, it's that side of it, it's that whole person view, from a movement perspective, from a health perspective, from a psychological perspective, trying to understand, help them to piece the pieces together. Do you know, like I kind of see a lot of people that they struggle along, they have a lot of differing opinions. I think that's a big problem for people with pain. They have a lot of different opinions, and a lot of people are confused. They have no understanding as to what is actually happening for them. So I think someone, to come back to the question, someone who can help you understand what is happening for you, can help you make sense of your own journey, your own history, and your own circumstances, your own influences on what might be kind of increasing or decreasing symptoms at times. That's really, really important. If people aren't maybe looking at that side of things, there's possibly, especially for a chronic symptom, there's a lot left on the table.
There's so many questions I want to ask, but maybe it's worth covering the difference between acute and chronic.
Yep.
Because I think that's probably a big deal. A lot of people will, like, it's. I feel like it's somewhat inevitable that if you do something that you're going to push yourself, sometimes you're going to hurt yourself in an acute way.
Yep.
You know, you might have a tweak here and a strain there. Certainly if you're playing a sport where it's impact based, you know, rugby, martial arts, there's stuff that's out of your control that's going to...
Yep, absolutely.
So those
factors,
so maybe it's just worth like understanding the difference between the two.
Acute, obviously there's often a mechanism of injury for an acute issue. For chronic issues, there can be flare-ups more likely than an acute, or than a mechanism of injury. A chronic for me tends to be anything over about 3-4 months that's kind of constant or intermittent or persistent, that sort of thing. Whereas acute stuff, we know it's kind of done in the scientific literature. You know there's a healing process that takes place, and unless you have some sort of immune system health issue that compromises that, maybe connective tissue disorder that makes it different for you, there's a fairly standard healing process that happens for most people. Excuse me. Most tissues take different times to heal, so muscles can take weeks to months, ligaments maybe a little longer depending on the grade of injury, tendons can be longer, cartilage can be longer. So if you know that side of things, you can kind of set a semi-realistic expectation as to what the time frame should be.
Yes.
When that is surpassed, so like a classic example would be someone comes in 18 months after a twist of a knee, and they're still struggling with a knee, sore foot, hip issue, etc. That's a chronic issue for me. And then there are factors that go into that we need to explore with them to help them understand why they've been struggling, and to create, to understand the context properly, to create a plan to move them past that,
So how important do you think, like, understanding what the origin of the injury is, like, and understanding that? I think a lot of people sometimes, maybe this is my own sort of personal opinion, but they want to know, like, what exactly is wrong with it. It hurts here.
Yep.
What here is wrong?
Yep.
What's been damaged?
Yeah, so I think it comes up on a few points. Number one, central to almost all of the cases that I see on some level. I'd say 80% of the time, maybe more, is that implicit understanding that people have that pain equals damage. And I think you probably have encountered that and maybe come past that a little bit, but a lot of people maybe listening mightn't have thought of this even. If you have pain in your elbow, as you mentioned, it's implied that you have tissue injury there.
Yeah.
And the way I kind of see it, there's 4 scenarios. You can have pain with a tissue injury, you can have pain without a tissue injury, you can have no pain and have a tissue injury, and you can have no pain and have no tissue injury. Ideally, we obviously want to be in the last category there.
Yes, yeah.
The predominant thing I seem to see in clinic, and again, I have the population I see, it's probably more likely for me to see what I see. I would see people that have a lot of pain that don't seem to have tissue damage.
Yes.
So when you encounter that sort of scenario, you might find a very clear link to a previous issue, and you might find a whole mishmash of stuff that's coming together and creating this pain experience. So I think the second piece I would say there is, apart from pain equals damage or not equaling damage, is that if you are looking for an isolated source of issue, sometimes that happens. Sometimes it's never. You could be kind of shining the torch or directing your search in the wrong direction.
Yes.
And it's to recognize that a lot of things can influence pain, and it's quite a gray area answer, but it's quite a gray area of influences sometimes too.
I like to be able to give actionable advice, and so I think it's a very, very hard one because, as you said, it comes so much down to the individual. I guess to give you an example or a couple of examples that kind of support what you're saying is my girlfriend. She has problems of pain in her ankles, and she's just recently been to like 2 physios. Both of them are like, I guess I can't really see anything that's wrong. Or like, we don't understand. And then she got an MRI, and they were like, oh no, the ankle's fine, everything's fine, but she's still experiencing pain. So I guess when you have that acute injury, you're expecting there's to be some sort of damage that's associated with the pain. And then with the chronic injury, it's when that pain persists. And it shouldn't necessarily be because there is some sort of physical damage. So what could be the reasons that somebody might be experiencing pain?
Again, plenty of these. It could potentially be a loading issue, movement issue. It could be that the level of activity that they're trying to return to, as an example, is beyond what their system is currently capable of handling, which may be irritating without injuring, overloading without injuring, if that makes sense.
Okay.
It's one option.
So somebody who is used to being able to do loads of pull-ups, then maybe they get an elbow issue and a shoulder issue. They stop doing it. They come back to training and try to do loads of pull-ups again.
Yeah, and that's a pacing issue. That's a return to activity issue. So that can be managed. Progressive overload is a really, I'm sure in your own training, you've obviously done loads of that. That's a way to overcome that. I would see a lot of clients who get that exact feedback. They've been assessed. They can't really find anything that's wrong. They also have had x-rays, MRIs, scans, and they don't find anything. So they're kind of left in this no man's land.
Yeah.
And they bounce around people. That's kind of who I see. So most often you will find with those people, well, maybe not say all the time, you would often see, how would I say this? Like a learning effect, I think, happening potentially within that person's body, where they may have had pain appear for no reason, adapted movement. Maybe they've had an injury in the past and adapted their movement around that, which obviously makes sense. And those behavior changes, those movement adaptations, if that's repeated enough, I think there's possibility there that can become like a pattern of protection, a learned pattern of protection, or a prediction from their central nervous system that they are going to experience a problem when they load in such a way, or they do certain tasks or certain activities. And
They've learned to expect pain.
It's kind of, their system is kind of has had that experience repeatedly enough that maybe maybe consciously or initially were expecting pain. So they've adapted things already. And maybe over time, as that has become a way of life for them, they've always braced their back, or they've always protected their knee, or whatever it's going to be, that they end up learning, and it becomes an unconscious kind of pattern of protection. So that is an option, I think. Like I'll often ask people, what would you have done before pain that you wouldn't do now?
Yeah, that's an interesting
And
question.
like they'll often, if they sit and think about it, sometimes it'll take them a couple of weeks to actually come up with all the answers. They'll go away and think about it, and they'll come back and say, David, I don't put my coat on the same way. I get into the car with my hands instead of just jumping in, or I go up the steps sideways, or stuff. They're doing things that is now their normal that they don't really recognize or still adapted. Tack onto that all of the psychological side, where there's fear, where they might be trying to Google and look at what they can find to relate to their back issue. I have this idea with people a lot of times when they're in that kind of space where there's no real apparent structural issue, that there's, for those people, a lot of times there's an unconscious storm happening. That's what I call it. So it's the fears, the worries, the beliefs, the opinions, the labels, diagnosis, all of that stuff that gets that implies potential for threat, potential for harm, maybe implies fragility for them, and they don't really recognize its influence. And that can be sitting behind the surface, unconscious to them, influencing their perception, I would say, of what's happening in their body, and therefore driving, or at least influencing, a lot of responses that they feel as pain, restriction, tightness, all of that side of things. So if that's happening and no one has ever shone the torch in that direction for you, there's possibly, again, a lot of stuff that you might not appreciate that is influencing your system.
I guess that it's the sort of thing that happens gradually over time as well, because naturally we don't want to be in pain.
Of course.
If something painful happens, it's like, I'll stop doing that for a bit. I guess you probably either end up on two ends of the spectrum. You're either the sort of person who that you just sort of brush that off, it doesn't affect you, you go back to doing training and don't think about it too much. Or you are like, I'm the person, I've got an issue with my elbow, and then you begin to identify with that issue, and it sort of, I guess, to use your words, it builds up like a story around, it becomes part of your story.
Narrative, huge.
I can't do that exercise because I've got problems with my elbows. I can't do this. How would you, I guess, help people build the confidence to be like, I can actually go and do these things?
Yeah. That's one that probably needs to be unpacked and explored over time.
Sure.
With the person. And I think central to that, if you're going to introduce that to someone, I think they have to trust you, first of all. So a lot of times when I'm in clinic with someone, I'm looking to build some trust with them first. I think when it comes to it, what you're looking to help them with is to build awareness around influences, and then to build awareness around what those influences mean for that person, because there's a whole meaning piece that sits behind all of that. So if you could have a belief that you've a back of a 70-year-old, that in and of itself might not be a problem. But when that means that you can't lift your children, or you can't exercise, or you can't lie in the bed the way that you feel you should be able to, that's the thing that drives a lot of problems, in my opinion.
Sure, and limits you from...
Massively. Changes behaviour, completely. Changes behaviour, changes life.
Yeah.
To put it that way.
Yeah.
And I think if you can help them to see that part of it, then there's an opportunity then to say, well, hold on a minute, is that meaning actually the absolute truth? Or is that based, again, upon those beliefs, upon all of that stuff? Is that a meaning you made at a time when you were quite vulnerable, when you had no other countering opinion, as an example, or countering pieces of information? And might that still be influencing you to a significant degree?
So say, for example, like a lot of people, obviously, who I share information with, they're interested in training. And as I said, injuries kind of happen. And you end up training around it, which I don't think is necessarily the worst thing in the world, because you want to keep doing something. But when it comes to like, at what point, not maybe at what point, but like, how do you go about no longer training around it and beginning to approach and bring that injury into your training?
So for me, what I think that is where a therapist is really useful. Doing that on your own can be quite difficult. You need a little bit of guidance with that. I think I kind of have this idea of contrast experiences being important here. So if you have a knee that's chronically sore, you've moved around, adapted around, etc., how can we give your central nervous system a movement experience, a loading experience ideally, that does not provoke the same type of response? Is there a way we can do that, like a contrast experience, to demonstrate for your body that this knee actually might be safe to take some load?
So perhaps maybe like the common attitude is like, we want to load it in some way, which I think is good. But maybe if there's still that presence of pain, there's still a little bit of doubt in the back of your head that maybe this is still doing something bad. Maybe I'm still not strong enough. So you're trying to look for something that like feels really, really good.
Yeah, that's
you
that's
can
one
load.
approach. And also, like, it's not to avoid the presence of pain.
Yeah.
I mean, I think a loose guidance I give people is that if it's below like a 4 or 5 in terms of discomfort or pain, if you are comfortable to just expose yourself gradually to that, you may start to see that your system will start to recognize some safety or a lack, not as much threat as it is perceiving maybe around that, and start to gradually allow a little bit more, aka that prediction of needing protection is updating a little bit,
Yeah.
to use that maybe terminology around it. I think that's a useful approach.
Yeah.
Reassurance, I mean, Louis Gifford, who, I don't know if you've ever heard of him, he's one of the
I never.
best physiotherapy writers. I think he's passed away now. He's a brilliant physiotherapist. Wrote an amazing book, which for me is like the Bible of physiotherapy in terms of a biopsychosocial approach, aches and pains. He wrote that reassurance is a really powerful painkiller, and I really, really agree with that.
Reassurance from the perspective of like, it's going to be okay.
It's going to be okay. Or as an example, if you go and you start bending that knee that's sore and it maybe irritates you right now, or it's a little sore, reassuring them that, knowing maybe from my perspective that human bodies are incredibly robust, that maybe
Yeah.
they've had a scan that doesn't show anything on their knee, knowing that even though it hurts right now, the level of loading you're encountering right now doing this knee bending or quad extension exercise, whatever it might be, you are not anywhere near the physiological limits that will create tissue damage.
Sure.
That's a big piece. So if they know that, well, I'm not anywhere near that level of creating injury, then I have, and if I usually would say to people that more than likely is some sort of protective response. If we can demonstrate willingness to go towards that a little bit, we give yourself a chance. You give your system an opportunity to recognize, well, hold on a minute, nothing bad has happened there.
Yeah.
And that, I think, is powerful. That can be the thing that starts the cycle turning in the opposite direction, and we can progressively build on that over time.
I think I can definitely contest that, because I've had my fair share of injuries over the years, most of them just being stupid. But the one thing that has actually given me, or the benefit I'll take from it, is pretty much, apart from currently rehabbing a labrum tear,
Which I think you're doing quite well with, based on Instagram. You're getting back to your
still
push-ups
could do
and
some
stuff.
handstand push-ups and things. Every other point after an injury, I've been at my strongest. So if you imagine it almost like the stock market, in which you have those bull markets and bear markets, like it's still, the trend is still generally up. And I have the confidence that things will get better. This is only a temporary thing. It's not going to be the end of the world. So I guess maybe I've somehow managed to build the confidence to be like, look, it's going to be okay. I'll go back and do it. How might you modify exercises to kind of reduce that perception, that fear, and make it feel like it's something that's more safe to do?
It's a good question. I mean, that is partly, I think, the one-on-one aspect of working with someone. You have to know the person.
I understand that I'm asking lots of like
no,
how,
it's cool,
because
it's
I think
cool.
it's like kind of people want to be able to apply this maybe to their interest.
Of course.
Obviously, seeing somebody one-to-one is the key.
I mean, the people who, as an example, a person who maybe is coming from a place of feeling like their body is quite fragile, or maybe that's implied and they're unconscious of that. But if that's the place, then you obviously want to start slow. You want to start with pacing the exercise, the sets and reps and that sort of stuff, nice and gradually, and looking for your system's response. Like I would often say to people, I'd prefer that you start with a minimum dose that you're comfortable with and gradually ramp up, even if it takes you 2 months to ramp up to where you think you should be able to. I don't really care. I prefer you to do that so that you get a bit of sustained time having a positive movement experience, having a positive loading experience without hopefully that many flare-ups. The second piece of that is that I tell them that flare-ups are a normal part of the process.
I wanted to ask you about this.
Completely normal part of the process. And for me, it was a big learning point for me as a therapist when I started to actually implement a conversation piece to tell people that flare-ups happen. They're not always within your control. We can pace and we can do everything as appropriately as we can, but they're not always within your control. And what's important with a flare-up, I think, is to... I have this conversation piece I give to people, which is like the mountains and the speed bump. So I think when you're a person, and maybe they've had loads of flare-ups in the past, if they have a flare-up of a symptom when they're working through something like this, if the meaning piece isn't kind of delved into there, and there's not a conversation around the flare-up or what it potentially means, that person might go, holy crap, this is me right back to the start. I'm going backwards. This means I'm fragile. This means, and it's that meaning stuff that drives the response. And if you then enter a secondary stress cycle, as I call it, like a secondary ramp up in anxiety, fear, all that, that's like the whole experience ramping up into becoming a mountain. Sometimes people hit that mountain and bounce backwards, and that's the cycle they often get stuck in.
Yeah.
Whereas I think navigating a flare-up can be learned, can be a skill that you can acquire, and I think that's obviously for someone with chronic symptoms a really powerful thing to help them to gain. And I have obviously an assessment with someone might be part of how you navigate that. It could also be that, like, if you haven't had a higher load, higher speed experience in the last couple of weeks, you're probably less likely to have a fresh injury than if you have had a fall, a tackle playing sport, stuff. So you're looking for a mechanism of injury, I suppose, in a way. If that hasn't happened, that's it. Let me be straight. It's not a guarantee by any stretch of the imagination, but it's maybe an indication that this might not be an injury. I think that's the fear for most people. I've injured myself again. I'm going backwards, and I now have to start all over again. The second piece then is maybe have your stressors increased? Has your sleep really regressed for any reason in the last while? They are well enough established in the scientific literature as predisposing factors towards a flare-up. Are you currently obsessed with that area? Do you check in, and are you plugged into that area, monitoring how it's doing all of the time? Are you afraid of that area? Is it constantly on your mind? Those things for me start to lean me towards flare-up and away from a fresh injury. So if the person has a little framework like that to help maybe sort it out a little for themselves, I find that really helps them to kind of stop that speed bump becoming a mountain. And then what they usually do if they can sort it out, and I encourage them to regress exercises usually at that stage and go back to stuff that they've done before that they know is safe if we've been working together for a little bit of time. And usually you'll see that speed bump will level out and they'll get to progress onwards. Yeah. And the idea would be over time, if it's possible, that you have less frequency, less intensity in terms of those speed bumps. Maybe you still have them over time. I'll put it to you this way, I don't think it's logical or should be expected that a central nervous system that may have learned the need for protection over a longer period of time will just drop it all.
No, and I as you were saying that, I was like, literally last week, somewhat maybe 6 months or so, my shoulder's been feeling good. I started doing some like basic one-arm hands. I wasn't doing one-arm handstands, the prerequisites towards it. And I'd done a bit of that. Shoulder, like, I could feel that it wasn't stable, but it felt pretty good. And then I went to pick up Molly in like a weird internally rotated position, and I felt this like little twinge. And then immediately my brain went to like, oh no, what have you done? You shouldn't have done that session.
Yeah, the self-blame comes in and all that stuff.
Just because you were saying that, I was like, I've literally had that this last week, and it probably took me 2 or 3 hours just saying to myself like, no, don't worry, you literally picked up a dog. Like, it's not...
How much kilos? What, 5 kilos maybe?
9 kilos.
9
but
kilos,
like,
okay.
Yeah, and I was like, I went through that whole cycle with myself, and then my shoulder started aching, maybe because I was like thinking about my shoulder.
Possibly.
And then I was like, you know what, wake up tomorrow, see how it feels. And I woke up tomorrow and I was like, it's fine.
And that's another piece. I mean, like, if we are starting to kind of get back into, kind of going back to an earlier question, I think approaching a problem, it's like, can I keep the reps and sets low? Can I keep the experience of movement low for the initial time? Do I have pain during it above a 5 or 6 out of 10? If I do, I want to back off a little.
Yeah.
If I don't have that, do I have a ramping up of any discomfort? Like muscle soreness when you start to move an area, especially if it's chronically not moved and chronically protected, can feel like you've done a workout there at times. That's not what I'm talking about. If you have an increase in the symptoms that you know are, this is my problem symptom, we obviously want to pace a little bit less aggressively than that, or less forward than that. If you wake up the next morning and you're okay, I kind of have a loose rule of 3, maybe 4. Do that same thing again. Give you a little break. Do it again. See how you are the next day. Do it again. If you're waking up 3 or 4 days in a row and you've done that thing and it's not that much of a problem, maybe now you can increase the reps a little bit. You can increase the time spent doing that. You can increase the frequency a little bit. And it's teaching people how to pace themselves so that they have an idea of how they can increase and decrease this.
Yeah.
Why is that important? It puts them back in control. Most people with pain feel like they're completely out of control, or they've got no sense of what they can do for themselves.
No.
Self-management is what I aim for with people over time.
And when people are injured and they can't figure out what the problem is, or it's not going away, they will sort of manically look about. They'll either avoid it, or if you're proactive, you're trying to solve it, but you're running around trying so many different things, maybe not giving them time to work to try and find that solution.
And again, a lot of times what I see with that are people who, for no fault of their own, their life experiences, their understandings of what's happened have led them to this idea that their body is not maybe as robust as they ideally could believe it is, or could see it as. And when they do go to really reputable people, because I know loads of brilliant physiotherapists, brilliant therapists all around the place, they might have been to some of these people and really done good work that on the face of it looks like that should be sorting that problem out. A lot of times they have not really factored in the kind of more psychosocial side of things, that unconscious storm I talked about earlier. They've not really factored in that, you know, they've got a seriously stressful job and they don't sleep well, and that these things can be potentially anyway continuing the pain cycles and maybe setting the scene for flare-ups. Maybe they don't have the skill to navigate a flare-up, and they don't know that a flare-up doesn't mean they're injured and they're back to square one. It's stuff like that I see a lot of people struggling with.
I think, as you mentioned, like, oh, you've got the back of a 70-year-old. Like, maybe as a therapist, that might be a bit of a tongue-in-cheek way of saying your back's not great. But like, actually, if you were somebody in pain and...
Oh, man, when you're vulnerable, stuff like that hits completely differently.
Yeah.
Completely.
And it sounds more like therapy than anything, really.
It does. And I mean, I'm always very clear with people as well. The amount of people that I would have met through the years that come to me expecting a fix is...
So I was just having a thought in my head, and you've literally just answered it. So, like, and I feel like that's also necessarily a little bit of education for the patient. It's like, certainly when you're paying money to a physio, you're like, fix me, please.
Yep.
And a lot of people will expect to go in, oh, I'll rub my shoulder, make this feel bad, and I'm going to be fine. I'm like, kind of doesn't work like that. So I guess, like, how do you manage that expectation? Because I feel like a lot of times physios will they will give treatments even though they don't think that it's necessarily the best option, because that's kind of what the patient
expectations
expects.
Well, again, going back to it, questions for me lead to the answers self-explanatory. But if you ask good questions and you ask a person, I'd be direct with it. What are you hoping for here? What's your expectation? What has treatment looked like for you in the past? Has it always been, just as an example, maybe some hands-on work, manipulation, massage, and some exercises or stretches? Has anyone given you any broader look at kind of your life and or any strategies to improve your sleep, and stuff like that? It's asking what they're expecting. A lot of people turn around and say, "I don't care. I actually don't care what happens as long as I get past the symptom," because again, they're there
most
for
people
the symptom, So
yeah.
I mean, there's kind of a journey people seem to go through from that acute flare-up-y type stage towards the chronic side, where they start to recognize that treatments can help, but they don't solve the problem at times. And then when they end up in that space, they're open to understanding more. I think they arrive there, which is maybe a failure in the education side of things or something at some level. But if they arrive there, they're more open usually to kind of looking at a wider range of topics and saying, well, I kind of need to get this sorted out because it's gone on for long enough. So let's explore this. So I think people they unfortunately end up there.
So you mentioned a couple of times the wider picture. So stuff outside of just exercise related remedies.
Yep.
Do you want to briefly go over like the different pillars or whatever you want to call it, the buckets that you could do, and then maybe we'll dive into them a little bit deeper.
Yep. So for me, I think there's kind of two parts to this. There's topics within it. There's access to knowledge and support, and then I think there's self-regulation.
Okay.
I'm saying this is coming up for me in clinic over the last while as a kind of topic to chew on in my own head. If you don't understand what could influence your symptoms, again, as we mentioned, you could be shining the torchlight on in an area that's not going to maybe move the needle for you over time.
Yeah.
So what could that be? That could be, again, some of that kind of more structural, body-orientated stuff like previous injuries, like loading capacity, like movement options. If you lack some of that stuff, it can obviously influence where you load, how your symptoms feel. The kind of psychological side of it, again, we've talked a bit about the belief systems, the narrative that's been built up around your symptoms, what the meaning is of any labels, diagnosis you've had, all that opinion side of things, comparison to others who have had similar issues. I feel there's a lot of people that get really frustrated when they can't achieve the same progress that somebody else can, because again, everyone has a different story and there's probably reasons for that if you can break it down. The self-regulation side of things then is managing stressors is a massive part of life, never mind pain. They have potential to have a negative influence. Breathing is one that can be quite useful for certain people. Sleep for me is a foundational piece. Hygiene around sleep. Not necessarily something I talk about that often, but potentially can be influential for people, are their diet, and then energy systems, that sort of stuff.
Sure.
Like there's loads of stuff there that if we can help a person, as an example, to sleep a little bit better, if they are the sort of person who's sleeping 3-4 hours a night, that's going to make it really hard to overcome a symptom, because your biology has kind of been driven towards less regulation or less ideal regulation of itself, do you know?
Yeah. From a sleep perspective, what would you get people to do? What do you think is worth people's time?
From what I understand, good sleep starts with what you do in the morning. So
I completely agree.
Morning light exposure seems to be one of the biggest pieces. Circadian rhythm, which is your natural day and night cycle. This planet has a circadian rhythm. Everything in nature has a circadian rhythm, everything that grows. So we are no different. Light exposure in the morning is a crucial part. And I don't mean just flicking the light on in the bedroom or in the kitchen. That is light exposure, but that's an awful lot less powerful than natural light, natural sunlight, even if it's like what we're looking at right now through clouds.
Which is torrential rain.
Torrential rain, Storm Ciarán, and
Welcome to Ireland.
Welcome to Ireland. Loads of clouds. So, and this is what we get most of the time, to be fair. Light exposure is a signal to your nervous system to start ramping up the daily processes. So if you think of like, as an example, cortisol, stress hormone, has a daily rhythm, a circadian rhythm. You want to ideally kind of link that rhythm as closely to what nature intends as possible. Yeah. So I recommend, as a practical kind of way to do this, even if it's pissing rain like it is outside here, it can be as simple as opening a window. You can stay inside and stay warm. If it's possible, pop out ideally as close to sunrise. Mm-hmm. And I know that in certain parts of the world, that might not be possible. Yeah. It can be really late. Your working day could have started. It could be really early. You might not want to get up that early. Ideally as close to sunrise, get that strong solar signal to hit your retina to signal what's called your suprachiasmatic nucleus, that master clock in your brain, to set off your daily rhythms. Yep. Get that in the morning time. I recommend for most people about 30 minutes if they can. And again, I will take some rather than none.
Yeah. If you can stay outside for 5 minutes.
5 minutes, I'll take it, versus 30. If it's not possible, if routines and life and work and all that doesn't allow it, if it's possible, couple that with a bit of breakfast and then a walk, and then you set off the rhythms quite nicely. Ideally, I would say maybe a little bit of light exposure during the day. So if you've got lunch around 12 or 1, get out, have a little bit of a walk again, if it's possible. And then in the evening time, again, I like a little bit of light exposure towards sunset. Mm-hmm. The other part of it then is that if your sleep begins in the morning, you make, as far as I understand, you make a lot of melatonin in the eye and in the skin whenever you expose yourself to natural light. Yep. That stuff is stored, for want of a better word, until everything is dark. So we then see like light hygiene, light exposure late at night becoming quite an important part there. So this is where all the advice about screens and blue light and all that, people kind of it's kind of filtering into public consciousness now. It delays your release of melatonin. So as far as I understand it, if you and I are twins, have the exact same day, we get our light exposure in the morning, we make some melatonin, we get our light exposure in the evening in the sun. Then if I am on my laptop or my Kindle or whatever for a couple of hours before bed and you're reading a book by candlelight, different light exposures, if we get a blood draw around 1 o'clock, let's say we go to bed at 10, get a blood draw around 1 o'clock, my melatonin could be up to 80% less than yours.
Yeah.
And that's a huge thing because that then feeds into restfulness, your sleep, how deep your sleep is, how replenishing your sleep is, into energy systems, to your immune system function. There's a lot of things that can be unpacked by that. So that's a piece that actually doesn't cost that much in terms of money.
I mean, it's free.
It's free, more or less. Time is what it costs, and that's where people struggle.
Yeah.
And going back to that piece, that's the self-regulation piece where people struggle maybe to self-regulate, or they don't know what's appropriate for them. That is a huge one. If that over time done consistently becomes, usually, unless there are other factors influencing, it becomes a person who sleeps better. And that is more like a regulation strategy you'd want to see for someone who's got persistent pain. I mean, I think the research shows that if you sleep less than, I think it's 6 or 6.5 hours and more than 9 hours, it increases the chances of a pain experience because we don't regulate ourselves as well with that too much or too little sleep. So there are kind of biological things that we can take advantage of. Self-regulation that way.
Yeah.
I mean, that's putting in place some stuff to deal with stressors.
I think the too much is an interesting one as well, because as you're saying this, I was thinking about some examples of friends and stuff, and a lot of people would be like, I haven't slept that much, I went to bed late, I'm going to lie in.
Yep.
And that's when we get this like disjointing of different bedtimes, different wake times. And because your sleep is so dictated by that morning light exposure, like, okay, maybe you didn't sleep great last night. Is it better that you lie in, or is it actually better that you wake up in the morning and you reset things and start from a good foundation to then get a great night's sleep the day after?
I think it depends on how you do things over time. So if it's like if you're consistently getting up and getting your morning sunlight, maybe 1 or 2 experiences of having a bad night's sleep, sleeping in it probably don't matter.
No, it's not.
If it's consistently the other way around, where your sleep schedules are all over the place, I personally, knowing what I know, would prefer that you go and get the morning sunlight and have a nap later.
Yeah.
Because you're regulating your system over a longer term trend. I think that's a piece that a lot of people don't really appreciate as much as looking at it with a trend view versus a data point.
I think,
and that's for everything.
As a human, that's so hard to appreciate and understand, because as you're saying this, I'm just thinking about kind of maybe somebody's reaction to this in terms of like the opposite. So, you know, to play devil's advocate, they'll be like, oh no, you know, you can't feel that, it's not making that big difference. But actually, like, when we're talking about this, it's not like 2-3 weeks. It's something that's going to impact you over years or decades.
Yeah, longer.
Really, like it's those habits that you build up.
It's really, really hard to think like that. It is.
And it's like, how would you put that into a scale? And, you know, I guess you have to have trust in the person who's giving you the information, have faith in that, like, that's going to be good for you.
Yeah.
I do think it's the sort of thing that you will feel benefit in the much shorter term.
Yep.
But yeah, it's very, very hard to kind of, unless you really believe the information that you're
I think
being
that's
told.
what it comes down to. I think it comes down to when you're playing devil's advocate there, that strikes me as a person who has a belief that is counter to that, and at that point isn't willing to maybe explore that or change that, and that's okay.
Also, perhaps somebody wants to justify their current behaviors.
Absolutely.
I like sitting on my like at the end of the day, there's a big dopamine hit to like sitting and scrolling on your phone.
Absolutely.
There's a reason that apps work in a certain way, and it's to keep you on it. And you do have to apply some self-discipline to make sure that you can use technology and get the most out of it without it being detrimental towards you. And like, yes, blue light at night, I think it's pretty well established that it makes a significant impact on you. But you could take the position that like, it doesn't matter, I get good sleep regardless. But like, you're just kind of justifying the current behaviors you have rather than...
Yeah, and I mean, it's also like everything is self-perception. I mean, I definitely remember reading studies where a person, I think the gist of it was that a person who is sleep deprived can never accurately measure how sleep deprived they are. When they do tests like reaction time tests and stuff like that, they always overestimate how good they are and they underestimate how bad they are. And when you actually look at the scores, they could be miles worse than they feel they are.
Yeah.
So it's hard that way.
Sure.
So it's
You get used to the state that you're in.
yeah, it becomes your normal, and you habituate to that. That's hard because you might not know how good it could be because you feel okay. Maybe feeling okay is acceptable. That's your own judgment, I suppose. You may feel significant benefit from it if you're willing to give it a go.
Yeah.
That's
And I think as well, like you can get the 80% rule, right? The principle. Like do most things. You can sit on your phone a bit and like after the sun's gone down. The sun's going down at the moment, like 4:30 here. It's like realistically, you're probably going to use some technology after that point, but just maybe 1 or 2 hours before bed, try to avoid it. Try to turn lights off. Have some candles on. Make sure you get up and see some light. Like you don't have to. You don't have to live like a stoic and
100%.
Tunnel vision and
tunnel vision on it. Like
like I
perfectionist
can't go
almost
to a
on it.
party. I can't socialize. Yeah.
Of course, like you don't have to be like that. I mean, life has to happen too. So I think if you look at it again with that trend idea, if you do this 80% of the time, like that's a piece I use with people for all different types of rehab and all that. If what can you do for 20% of your effort or less that gives you 80% of your results? Can you do it 80% of the time and not beat yourself up for the 20% you miss?
Yes.
That gives you room for error or to fail. And then if, as an example, if you're going into trying to improve your sleep hygiene or you're trying to do some rehab work, you're not used to kind of maybe doing exercises as regularly, never miss twice. Maybe chalk off 1 week to when life goes crazy and never miss the second week. If you can do that over time, you're not guaranteeing, but you're giving yourself a trajectory that's going to lead to progress, lead to improvement.
I like that. Never miss twice. I think a lot of people get into a bit of a trend of they want to do something perfectly, and if they can't do it perfectly, they're just like, oh, why do I bother? And it's like, okay, if you're a smoker, like if you only smoke 5 days a week rather than 7, it's going to be better than, as an extreme example.
Yeah,
It's like, just do something.
It brings another point up for me as well, is I kind of say to people at times, self-blame doesn't really have a place here
No.
in this process. And if you find yourself self-blaming,
but I think it's a hard one to get out.
it's a really hard one to get out of. It's I think if you can have awareness around it and catch it, maybe you can pull yourself back from it a little bit more readily. Doesn't mean it's not going to happen. It's not to try and suppress it completely. It's to catch it and get back on track with your mindset, ideally.
Do you think that perhaps like because we maybe have more examples on social media of people like this is how I do it, and you can because you get to filter and edit what is going to go online.
Yeah.
You get to
Curate
present
your
a
life.
much more perfect example than like actually is realistically possible.
Yeah, I mean, I think that's one thing I would love to see less of. I would love to see more realism. I often talk to clients about coming back to what's realistic, because again, what we're talking about there, that self-blame, that maybe perfectionist tendency to want to do everything perfectly or want to get all my rehab in it or whatever it might be, it leads to this real stressor.
It adds to the stress as opposed to takes away from it.
Exactly. And for some people, it might take it away. For most people, I think it adds to it. And then it leads you to this place where things fall apart.
Yeah, you feel like you're a bit of a failure because you can't stick to
If you
this.
had a little bit more of a realistic appreciation, maybe that life is tough.
Yeah.
Life is messy. Life is not predictable a lot of times. I think almost definitely on a weekly basis, probably a daily basis in clinic, at least one client will come in and say, well, I haven't been so good at doing my homework. And I'm like, okay,
Yeah.
I don't care. I would prefer that you're honest and that we use it as a reorientation to maybe get back on it, maybe deal with, have a chat about what you struggled with. If there's something we can advise to help you with that, then cool. That's a step forward in my opinion. I bake that into all of my expectations for clients because life is not, you don't have all of the hours just sitting in front of you and you can fill them as you want. Everyone has obligations and events that happen that dictate to you, do you know?
I really like what you said as well, as you talked about kind of giving advice to clients. You said you asked them, I think when we said about people's expectations of rehabs, like, is this something you think could
Oh,
work
yeah.
for you?
Yeah.
Rather than a lot of people will be like, I'm the expert, I know what's right.
Yeah.
This is, and it's like, technically, probably you are correct in terms of like, if we had an ideal situation,
Yep.
those are the things you should be doing, but making somebody feel like they have to do that,
Yeah.
maybe they stress about they can't, as we've mentioned, all these things,
Yep.
stress about can't doing it, you don't do anything. It's like, okay, what realistically?
I mean, again, like that, you said earlier, the best rehab in the world can fall prey to your perception. It can also fall prey to your lifestyle. So you could have the best ideal plan, but if you can't execute it, it doesn't matter as much. So it's about fitting it for that person.
I can really identify with this. Over the past couple of years has been a big struggle for myself personally, with more of just like that identification as to the person I used to be versus like the situation that I was put in. So sort of mentioned to you, I was renovating houses, but
Yep.
I think this is quite common on fitness advice in general on YouTube, is that we are in a privileged position in terms of that's what we do as a job. So one, we have much more time to dedicate to. We have, the financial incentive as well.
Yep.
The motivation to do it is significantly higher, I guess, in that regard. And yeah, you don't have those external stresses, and most people are also young as well.
Yep.
In that position. And I think when I was a student training and when I was doing this as a job, like I had all of those things in my favor, and it wasn't until the last sort of couple of years when I've had those external influences and I haven't been able to do things perfectly, and I've gone through that process of being like, what's the point? I can't do this. And I stopped sharing stuff online because I was like, oh, I'm not doing what I preach. And then I was like, actually, I need to really adjust my opinion on this.
Yep.
And actually, like, what is realistic? Something is better than nothing. And I was, it's honestly been like, that's been the biggest change for me over the past couple of months. Not beating myself up if I can't do a session. Like yesterday, I did 20 minutes outside because we've been traveling around. That's all I had time for. Like I was like, it's not perfect, but it's probably not going to get me towards those really high level goals. But like equally,
it's not taking you further away.
Exactly. So, exactly. So it's been a massive mental shift, and I think
I think that one is one that I think is common for a lot of people. They may not appreciate that that's what they're facing. Maybe hopefully a conversation like this helps them maybe see that might be what you're going through.
Yeah.
And to know that is normal. It's hard. It's not. If it was easy, you'd have sailed through this already. Do you know?
Yeah.
I think that's a significant piece. If we can help people see the journey for what it is, coming back to that realistic view on things.
Yeah.
That is a piece that takes away against secondary stressors.
Yeah.
The perfectionist maybe tendencies at times. It helps you be okay with doing what you can.
Yeah. It's also slightly boring and like as advice.
Yeah, of course
it's like, it really annoys me because I'm like, it just is, it's the best advice, but sometimes it's just not very glamorous, and it's hard to get somebody really inspired when they
Reality is full stop.
It's very true. Speaking of which, so we had sleep. You mentioned briefly about diet. You mentioned breathing. I'm interested to hear what your thoughts on breathing
So
is.
for me, right, I think if you how do I put this? Breathwork's really popular at the minute.
Yes.
And there, I think, is a lot of benefit to understanding yourself via your breath. If everything falls to pieces now on this podcast, both of our breathing rates are going to go up.
Yeah.
And it's a piece that I think you might not be able to change a stressor outside of you. It could be going on for months. You can always come back, if you can get the self-awareness, which is a part of this, to controlling your breathing. And that may be the difference between you breathing at a really rapid rate, which the kind of literature might say would be toward a fight or flight response, more stress in the system, more stress hormone release. You can always bring that back if you can be conscious of it. I think breathing sits at the fork in the road in terms of the brain, where it's conscious and unconscious access to it. If you are conscious of it, or you build the habit of being conscious of it, you can fall back into regulation, I think, more easily than if you're unconscious of it. If you're unconscious of it, you're being breathed by the unconscious autonomic nervous system, which is reacting to all your fears, all your worries, all your stressors, all your physiological inputs. And that might be the difference between you feeling completely agitated, irritated, overloaded, maybe tending towards more emotional responses, and you being able to bring yourself back to a calmer space. That I think is powerful for people.
Yeah, I think it's a really useful tool to have.
Yeah, I think so.
What can you give some examples? I've read a couple of books. I've read another Irish, what's his name?
Patrick McKeown.
Patrick McKeown. His book was great. And there's another one as well, Breath or Breathe.
James Nestor, yeah.
James Nestor.
So like I remember seeing an experiment done once with someone where they breathed at 20 breaths per minute. So
Yeah.
3 second inhale, exhale.
That's
right?
quick.
So really quick, really common actually as well. I
believe it's somewhere between like the 12 and 15 is good.
I actually think it needs to come back from that a little bit more.
I would agree based on the Patrick McCann book, and that's
so
what he was saying.
I would say to people, if you're trying to 12 to 15 as a normal response, probably not too bad. Anything maybe above 12, I'd say you're heading towards the kind of potentially towards the fight or flight side of things. If you can bring it back to the 6 to 8 breaths a minute, I think that's pretty safe to say you're going to be self-regulating better.
Yeah.
I can share a personal anecdote, and I'm not going to say it's anything more meaningful than that. I had a migraine a few weeks ago. Really uncommon for me. I was really depleted, poor sleep, a lot on my plate, etc. Busy week at work. Had a migraine. And for me, in that moment, when we got out of we were taking our kids to soft play, and the lights were really aggressive, and I was really irritating my eyes and all that. So, got out of that, got into the car, and about 8 to 10 minutes of that 6 breath a minute, and I used a stopwatch on my phone to kind of like it. The aura disappeared, the aura reduced, the headache reduced, and it helped me to self-regulate. Is that always going to happen? Maybe, maybe not. I felt it was quite useful for me to bring my system back down a little bit.
I think maybe it's understanding that, breathing isn't going to change your situation.
Yep.
Like if you're in a stress, not necessarily a stressful situation, but if you're in a situation with externalities that you can't control, breathing isn't necessarily going to change that situation, but it will change your perception
and your response to it.
Which I think is a really great way of thinking about it. I did, like, if you had a stressful day, just spending 5 minutes of breathing. When you were saying that, I think the piece of literature I referenced in a recent video of like a minimal workout, I talked about just adding 5-10 minutes of breathing, and I think that was like basically between the 4 and 8 breaths per minute was like the evidence for the slow breathing being relaxing.
I often say to people, if you can get 6 breaths a minute, 10 seconds a breath,
it's slow,
you're probably going to get yourself back to a more regulated space.
And from it's quite a big thing for flexibility training, which is obviously something I'm very
Relaxing
interested in.
and breathing into it. And
and also like somebody mentioned to me, I think it might have been Emmett actually, and he was like, if you can't breathe in a position, like if you feel yourself holding your breath when you're in a stretch, your body is prioritizing not breathing. Not dying. Like breathing is kind of important for living. It's prioritizing not breathing so that you might survive the position you're in. It's like it's telling you that you're feeling extremely unsafe. So
I see that in my assessment of people as well. I might put them into an exercise that's challenging, and I'm obviously looking to see how they coordinate that and how they whether they struggle, whether they don't. But I'm also listening. Can they breathe?
Yeah.
If they can't, it's probably telling me that they're above their threshold of current. Potentially above the threshold.
It's not saying you're not going to get out of breath when you do exercise.
Exactly.
It's more of like how you're holding your breath.
It's not to say that you have to be able to breathe through every single movement or exercise. It's not that either.
Yeah.
It can sometimes indicate a system that is struggling a little bit in a position. It's one option there. And I don't always say that it's definitely applicable, but it's just a little piece that you may see, obviously, in terms of facial expression and effort, and it might be one thing that kind of says maybe we'll regress this a little bit.
Do you have any opinions on flexibility, maybe in regards to injury prevention or maybe around treating injuries? So two prongs to that. Some people like to claim that flexibility decreases your risk of injury, and I see that a lot in like YouTube comments, and I obviously make content around flexibility. That's like the thing that I do. And I find it hard to be like, it's probably not going to decrease your risk of injury unless maybe you're doing a sport in which you require that really extreme range of motion. And then from a rehab perspective, I see some benefits depending on the injury and sometimes not. And I think, again, it's like 2 common misconceptions. 1, stretching prevents injury, and 2, that it will help heal your injury. Don't know if you have any,
so
if you want to tackle them individually.
Stretching, preventing injury. I'm really on the fence here. I can't say it does. I can't say it doesn't. Well,
As far as I understand, it doesn't.
yeah. I mean,
But I
I'd
think-
lean that way. I think actually.
But I think if you were to say, for example, you were going to participate in an activity in which an extreme range of motion was required and you lacked that range of motion,
Yeah.
not having it is probably going to put you at a higher chance of injury.
Possibly, yeah. I think that's fair enough
So,
to say.
so perhaps maybe as a couple of examples, if you were going to do jiu-jitsu and you had poor shoulder flexibility,
Yep.
you probably would be at risk of injury in some of the more extreme positions.
Quite possibly.
Gymnastics, certainly, if you're going to participate.
I
have
mean, I think like the
flexibility.
stretching flexibility side of it. There's like, where are you at within your current capacity, your ideal capacity?
Sure.
If you are at your ideal capacity, then stretching's probably not going to make that much difference for you. If you have an ability to expand your capacity, then maybe it has a protective effect for some people.
Yeah.
But again, that's also, like you said, if you're going to be exposed to those extreme positions, you probably want more ability to share load than less.
Yeah.
As a general rule. So that might be where it comes in. Second part of that was if stretching. What was
Is it part of a rehab process? Like a lot of people are like, I've got an injury, I'm just going to stretch out. And I will say from personal experience that it doesn't tend to help with injury. I tend to find that the common, we sort of said about you become hyper aware of it.
Yep.
And you might see somebody like they constantly be rubbing, like where they've got that pain, or they constantly be trying to stretch out. And I think it's that comes from a good place usually in terms of like you're trying to do something to help it, but I personally tend to find that it doesn't.
Yeah, for me, I think I agree with you there. I think stretching could be a form of loaded exercise, so I don't mind it from that perspective.
Yeah.
I think there's a like most things, like there's a lot of scientific understanding, I'll say, that maybe was developed in the last 30, 40, 50 years that is currently being tossed out. And there's a process. It's a process of always evolving the ideas. I think that stretching and flexibility side of things maybe has been established in the public mind as a thing that you do. It was a tool that, and it is obviously still relied upon by a lot of therapists, a lot of athletes, amateur athletes, gym goers, etc. I don't think there's inherently anything majorly wrong with stretching itself.
Yeah.
Do you have to stretch to reduce pain or to avoid injury? I don't think so. I think I would always prefer that a person, like you've maybe mentioned there, gets able to load in those more extreme positions. And I think that's probably as best you can mitigate the risk yourself. Do I think stretching has to happen there? It might be a tool that's useful for a person if they are currently quite restricted. Like I mentioned, that the capacity is restricted compared to where it could be. I think it's
I guess it's like a low level of loading as well to some
yeah,
extent.
it is. So it's that might be how how I would use it. I have this idea as well of giving I think I mentioned it earlier, giving a person's body, brain, nervous system, whatever you want to call it, an experience of movement in an area that is safe. A stretch may prevent or produce that for someone, and it could be beneficial for that reason. Like to someone who maybe cannot extend a hip after an ankle sprain or a hip operation, getting that opening up into the I'm gonna go into taboo territory here with a hip flexor, but opening up that hip into extension might be really beneficial because they could have been avoiding that for quite a long period of time and might feel like their system may gain a lot from having evidence of safety there. Do you know?
Yeah, no, I like that, and I think that's actually one of the things. So there's a couple of things with injuries that, like, if you injure yourself doing some strength exercise, sometimes it's more about just loading in positions. But injuring yourself doing flexibility training, which is not uncommon, certainly when people are pushing splits, I think that's a different kettle of fish. So, like, if you were going to approach restoring range of motion after injury, like what would be the things that you're looking for in that regard?
From that perspective, again, it's an understanding for me of how that injury and how that injury site plays into global movement patterns. So I've trained with a walking gait perspective, anatomy and motion, if you've heard of it. Gary Ward's anatomy and motion. I trained with that years ago. I find that to be a really useful framework for me. I'm confident with it. I can bring that across into my assessments quite well. I think that's useful. Because, I mean, you could have a knee injury that stops you from hiking your pelvis, rotating your hip, and side bending your spine. And you might see that there's lots of those pieces that need to be addressed, as well as getting the knee to bend. So I would often look at that from a joint structure perspective initially, as to what would maybe be ideal. And again, ideal mightn't be optimal or absolute here for an ideal. And then what can they currently do? And then it's a simple process. What might be blocking them from closing that gap? Assess their system. Can they load certain tissues? You might put them into a loaded exercise and they shake like a leaf. You can say fairly comprehensively, I think, there that that's struggling to share load. And that intermuscular coordination is what it could be. It could be just simply the system experiencing that range of motion has been avoided for a long period of time. If we can improve access to that, give them a way again to be active in the process, tell them what to hopefully expect, tell them how to manage it if they need to, and then progressively ramp that up over time. That's kind of my approach to it. So I'm always a fan of improving access to movement and then loading with progressive overload. It's fairly simple, straightforward, I think, but it's how I do it. Like,
I like that. I think that, you know, getting overly complicated sometimes is more of like a way to demonstrate your like, oftentimes the simplest approach is probably going to be the best approach from a patient's perspective. I just wanted to touch on what you mentioned about shaking.
Yep.
I think I've seen that a couple of times in some stuff online, and like getting people into kind of relatively quote unquote easy positions. Then you see this response of them sort of shaking or that inability to be there. What would that mean potentially? Again, I'm going general here.
Yeah. No, I get you. I think from seeing that in clinic, I think that generally correlates with people who have lost loading capacity in that position. So you might be bending a knee as an example, and at 10 degrees of flexion are absolutely fine. When you get to 25, you start
the knee shaking.
The knee starts shaking, and that's especially if that person has the full knowledge that I've had a scan, nothing wrong with my structure, I don't have any issues with muscular stuff like that. What is happening there for the nervous system to then go from I'm confident, I'm comfortable, this is easy, bang, whoa, shaking like a leaf? I think it's an issue with intermuscular coordination. I think.
As in, like, your muscle, your body's trying to fire lots of different muscles at the same time, because it's unsure how to get that synchronization.
That's certainly not going to get better without accessing that position. Mm-hmm. It will probably get a little better if you give your system a chance to figure the problem out. So if we can gradually, progressively do that, I think you often see restoration of like that smoothness of range of motion. Not always. It doesn't have to happen for pain, as an example, to improve. I think it makes a difference, though. I think it does. I tend to do a little bit of that in clinic at the minute. I'll put people into a position where I know this is going to probably load that quad or that calf or that hamstring significantly enough. And if it does, I see them shake like that, am I going to say 100% that's going to cause them a problem on a football pitch? Maybe. I mean, if fatigue comes in and their current way of loading that avoids this issue starts to break down, as an example, then maybe they're going to struggle. That might be where that symptom starts to arise. And if it does, then knowing that they struggle in this position and getting them problem aware in that way, and then starting to work through that with maybe different exercises or drills or whatever, that can often take that issue, reduce it significantly. And a lot of times I'm seeing in clinic that'll make them feel quite a bit better. And I think I keep things simple, and I could be wrong. So if I am, I apologize. I think that's restoring options to load share. I think if you look at a human being and you limit their options to load share, you're going to end up with issues.
Yes.
If you open up options to load share, you're probably going to.
So those adaptations to pain is limiting your ability, limiting your options to avoid the issued areas, and you're through rehab trying to expand your ability to have more breadth to solve the physical problems.
The analogy I give to people is if I pop you in the car now and tell you to drive to Cork, which is the other end of the country, but I take away Apple and Google Maps, and I take away motorways, you're probably going to get there eventually on the country road.
Eventually.
It might take you a little longer than me, but no, maybe not. If all the traffic from this area is heading at the same time, you have lots of people, lots of pissed off people, maybe roadworks, maybe accidents, maybe traffic jams. I liken that in a simplistic way to those are the areas of your body that your system is currently happy to load. And if you're missing some areas of maybe you're missing a motorway here or there, a really optimal way to do that or a better way to do that, if you want to call it that, if we can restore that, we load share, we spread everything. And I think that usually helps people.
Okay.
I see that quite a lot.
Yeah, I like that. I love that. Right, I think we're going to have to brave the storm and ask you some hot takes and then jump in the ice bath.
Right, let's do
to
it.
finish up.
Let's do it.
Right, let's go. Let's go. Right, let's rock. Oh, nice.
Okay, number one, I feel like with soft tissue therapy, you either have the traditional standard, which is like massage is going to fix all of my problems, or you have the opposite side of the camp, which is like soft tissue does nothing. What do you think about soft tissue work in its relation to rehab?
I think it's personal preference, totally. Do I think it's necessary? No. Do I think it's unhelpful? No. I think there can be benefits. I'm definitely in middle of the road here a little. Personal preference rules there. If the person feels like that's a necessary part of what they need to get better, give it to them. Get them to receive it. If they're okay to work away without it, I personally don't do that much of it at all. So I just work away on getting them moving and feeling and understanding and progressively overloading that way.
So I guess you would take the almost placebo effect route in terms of like if the patient or if somebody felt that the soft tissue work had value, maybe it is providing value.
Yeah, I think that is fair enough to say. I think if you don't allow for that placebo, if you don't appreciate that potential placebo, whether it's to do with soft tissue treatment or your conversational style with a client or all the other the non-specific elements in a treatment setting, if you're not trying to get those working in your favor, you're missing stuff.
I love it. Anti-inflammatories, things that mask pain. I guess earlier on in an injury, somebody might take something like ibuprofen, or on the more extreme end, you might go to a doctor or to the hospital and they will give you a cortisone injection. They're like, oh, you've got pain here, don't worry about it. We'll just inject something to the area. What do you think?
A tool that can be used. I'm kind of against the principle of anti-inflammatories if inflammation is a normal part of the healing process. For in one aspect, in the other aspect, I think they're useful if the person's not able to cope with the pain. So it's a kind of a grey area answer. You're probably going to get loads of them from me, but I think it's a tool to be used appropriately, and I do think they're probably used too much if they're dished out as a way to deal with a person rather than actually listening and understanding and actually assessing properly. Like, I mean, I'm not saying that always happens. If it does happen, then it's probably too much exposure to that. If that's the only strategy you have, find more.
Okay, yeah. So maybe an example I can think of is some friends who are either they were a gymnast or they were doing it, and they would just get a cortisone injection because it would basically take away the pain, and they would be able to just go back to doing their training as normal. I guess in that circumstance, if it's the only tool that you have, then
you're probably like, I mean, I know there's some research that say that cortisone injections can actually predispose you to more problems in the area, in the joint, etc. So not fan of it for that reason. If it's your only option in terms of pain relief, then you really want to be, in my opinion, exploring more, because that's not going to last you forever, I don't think.
I think the notion of perfect form, we talked a little bit about how that when you have an injury or you have pain, you will adapt to avoid it and you will create these different... What do you think about the insistence on perfect form to mitigate injuries or in general in exercise?
Oh, it's a good one. I think perfect form doesn't exist in the first place. There are ranges within perfect, if you want to call it that. So there might be, if you want to load your hamstrings in a deadlift, you have to maybe achieve a certain set of positions to get that to happen. Does perfect form happen all the time? I don't think any personal trainer, therapist has an ability to produce perfect form in a person. It's about how their system solves the movement pattern or problem or task. So within that, there's variability. I think there's enough variability. I think maybe an issue might be not perfect form, slightly different approach. Lack of variability could be a problem.
So if for perhaps maybe somebody has an inability to stray outside of a certain form, that could be more of a problem than not being able to perform something perfectly.
Yeah, I think so. I think that's what I see in my clinic.
They have to perform a movement in a certain way. Is kind of what you're saying?
Well, no, I think they have to have options within that movement. As in, I think having to do it in a perfect way is perfect form for me. That's how I understand it. I prefer that you have enough wiggle room and enough places to be able to tolerate what you're doing. That's my way of looking at it.
Last one for you. Hot or cold therapy when it comes to injuries? We're obviously doing some hot now. We're about to do some cold.
We are. I'm looking forward to that one. Again, I think it's personal preference. I think there's a lot of belief system stuff about this, that hot works, cold works, etc. If it works for you, temperature change can be, from a signaling perspective, can, I think, affect your nervous system's perception of what's happening. I think that's how it mostly works. I don't think it has to be one or the other.
Yeah.
So I think it's find what works for you. Have a if that's your preference, and go for it. I mean, it's a tool, again, to relieve or potentially reduce symptoms. Go for it if that's the case.
Love it. Cool. Great. We can enjoy the heat as long as you like.
Oh my goodness.
The-
Let's get this cold done.
The ice bath is inevitable.
Whichever one you want to go in, I guess. This one?
This would be torture, isn't it?
After you, sir.
Ah, we're not too bad.
Oh, yeah. Okay.
That is painful. I am not used to this.
So, this is usually quicker fire questions.
Yes.
If somebody struggles with getting cold, what might be the reason for it?
Lack of exposure, probably. Like
Stop.
me. Right now.
I feel like we've answered so many questions.
I'll be happy enough to get out. I'm freaking stinging.
Have you got any questions for me?
Yeah, why have you done this to me?
Thank you very much.
My feet are killing me.
I think, unfortunately, the storm has us beat when it comes to these cold questions, but I would like to say a massive thank you for David for joining us, driving out here. He is a wealth of knowledge when it comes to rehab. I really enjoyed this conversation, and I hope you got something from it as well. As always, let us know your thoughts, your opinions, any future guests, all of that stuff in the comment section down below, and I'll catch you in the next one. Have a strong week. Peace.